Everybody hi. Biologists now see aging inside the cell as a race between two clocks rather than one. The first is a classic telomere counter. Every time a cell divides, the protective DNA caps at chromosome ends shave off a few repeats. When telomeres grow critically short, they explode tip set off a DNA damage arm that halts the cell cycle and pushes the cell into senescence. The second newly appreciated clock sits in the nucleolus, the structure that builds ribosomes. As growth signals drive the cell to churn out proteins, the ribosomal DNA array in the nucleus swells and becomes fragile. Once the nucleolus passes a critical size, breaks in the highly repetitive DNA ignite their own stress response, also ending in senescence. Telomeres record how often the genome has been copied. The nucleolus records how hard the biosynthetic engine has been revved. Different inputs, same stop signal. Recognizing both timers has immediate scientific value. Measuring telomere length plus nucleolar area should give a sharper read out of biological age than either market alone, letting researchers judge whether an experimental anti-aging treatment truly turned back the clock. It is also widens the mechanistic toolkit. Pathways such as mTOR, IGF-1, and the sirtuins now need to be studied for their effects on rDNA stability as well as on telomere maintenance. Clinical practice could benefit too. Pathologists already use oversized nuclei as a red flag in aggressive tumors. Pairing that read out with telomere status could refine prognosis and shape treatment intensity. In geriatrics or metabolic medicine, a quick blood smear screen for enlarged nuclei alongside leukocyte telomere length might identify patients who are biologically older than their chronological age and therefore at higher risk of frailty or diabetes. Drug development may pivot toward combination strategies, for example, brief telomerase activation to shore up short telomerase couplet with mTOR inhibition or sirtuin activators to keep rDNA compact, aimed at extending tissue health without tipping cells toward cancer. Caution is essential. Cells need ribosome output for healing, and unrestricted telomerase can make tumors immortal. Any therapy must strike a balance, stabilize both clock enough to delay senescence, but not so much that normal growth or genome surveillance is compromised. In short, aging story is no longer told by a single hourglass. Telomeres and the nucleolus stick together, each logging its own brand of wear and tear. Learning to read and gently reset both clocks offers a fuller, more promising path to longer, healthier lives. Thanks for likes and sharing.